Hello, my name is TD Forss, and I'm a certified athletic therapist. I have a special interest in contact sports as well as concussion assessment. Today I'm going to be talking about annual preseason baseline testing. And the reason that we do this is that we want to provide some information on what your brain is able to do before it may get hurt. And we try and do this especially in contact sports, but also before the season starts. And there's a few things that needs to be involved in this assessment. One of it is a clinical history, which would include things like the number of concussions that you might have had before, your family history of concussions, and also family history of any type of mood disturbances or the like. Another thing that it should also include is a physical and neurological evaluation. Things that like eye assessment, range of motion of your neck, and also some motor strength assessments. Another area that we need to look at is your motor control, which would include things like your coordination and your balance. And finally, it should have some type of brain function assessment, which would include things like your reaction time, your ability to recall things like your memory, as well as attention. There are a variety of things out there that you can use to do these assessments or screens, and they're also called tools. Ones that we often use are the SCAT 5, which is also the Sport Concussion Assessment Tool, 5th edition, and it can be used for baseline, it can be used for concussion assessment, as well as returning back to play after a concussion. Another one that we often use is called the King-Devick concussion screen, and it's basically reading numbers rapidly across a piece of paper, and it's timed. So in general, if you have a qualified healthcare person evaluating you along with something like the SCAT 5 and King-Devick, it'll help out giving yourself a baseline before you get into your season, especially in contact sports.